Okay, I guess we can get started. Sorry, Jill could not be here today. She's in another meeting, and so you get me today. Um, and so we are pleased to welcome Dr. Jeff Bartlett, Vice President for Corporate and Foundation Relations, or CFR. CFR is a department within University Advancement Division and serves as a central point of contact for private foundations, corporations, and non-governmental organizations. Jeff is here with us today to discuss the Mother Cabrini Health Foundation and the changes that are going to be up to the upcoming submission process. So welcome, Jeff.
Thanks, Karen.
Yep.
I appreciate the time to come back and talk. I think this is the third year in a row that I've come and talked about Mother Cabrini. So for those of you who have joined me in the past, some of this is going to be very repetitive, but there are some upcoming changes that we anticipate having, and that's why we wanted to come and talk now to talk about some of those changes and the process that we're addressing. So those of you who have been involved, those of you who have you know participated in the past about these, as I said, some of this will be familiar to you, the timing. As I said, we are anticipating some changes, however. That's weird. Because in the past we've not been limited to the number of submissions that we can send to Cabrini. However, we are getting indicators that they are changing that process. Now, we won't know if they are or what that looks like until they actually send out the notice, which we anticipate being sometime mid-March. Excuse me. But in expectation and anticipation of that, we have created an internal submission, and so we'll walk through that, what that looks like here on the next slide. But generally, the timeline that we're dealing with is the same as what we normally have. Excuse me. With the addition of this internal submission. So the internal submission is open currently, and the deadline is Tuesday, March 17th. If the timeline for Cabrini is along the same lines as it normally is, we will get notification, as I said, next month, mid-March, with the window opening the end of March, 1st of April, and then LOIs due the end of April. Full proposals then we anticipate will be invited in June for either a late September, early December decision, depending upon the start date. And Cabrini has two start dates. It's either October 1st or January 1st. So that is the anticipated overall timeline. The concept paper, as I said, this is a new edition that we are doing this year in anticipation of this change. So concept paper is due Tuesday, March 17th. We are simply asking for a very simple one-page concept of your proposal, the budget that you anticipate, and typically with Cabrini, average grants are $250,000 or so. Identification, excuse me, of the program area, access to healthcare, basic needs, healthcare workforce, mental and behavioral health, or the general fund, and then a bio sketch. The review committee will review concepts and then identify a select group that will be invited to develop an LOI, and that will be based upon how many LOIs we can actually submit over the course of April. And I think I've got this in the slide here in a minute, but when I talked to the program officer recently and this conversation came up, they were talking potentially only allowing 3 or 5 submissions per organization. Last year, we submitted 27 LOIs. So the winnowing down is going to be significant and dramatic, which is why we're trying to get in front of this in the coming year. We will let the identified selected PIs know early April so that you then have a few weeks to develop the LOI as we normally would. The process for the LOI submission then is, as it has been in previous years. So we believe LOIs will be due in late April. The Corporate Foundation Relations Office will upload all of the LOIs, documents, and ancillary material and submit those on your behalf. This is the same as we've always done. We actually have the login to the portal, and so that's one of the services that we provide. We anticipate the LOI format will look very similar to previous years, although once the portal opens, we'll be able to get in and see if there are any significant changes. If you are invited, we'll communicate with you and share the template so that you have all that information. LPIs should submit the new notice of intent for those LOIs. Click would it be required at this stage because it is an LOI, but we can work with you on that notice of intent and anything with SPS as well. And then just a note, because I know this always comes up. Even though Mother Cabrini does indicate 15% IDC on their website, UB policy has always been that we do not charge indirect costs on Mother Cabrini grants. So that is the process that we're going through. I will pause real quickly. I'm going to turn the screen so I can see. So excuse me while I'm looking away. Any questions related to the process as it stands now? Either there's no questions or I've answered it brilliantly and you've got all of your questions answered. So that's what I'm going with. So let's talk a little bit about then what Cabrini is looking for, because I think that there's always a lot of interest in Cabrini because they fund things in so many areas that are so pertinent to the work that you all do. It's become a real source of interest over the last couple of years. But I think as we kind of peel back the onion on this, you'll start to get a sense of the sorts of things that they're really looking for. So let's start, very broadly, program priorities, access to healthcare. What does that mean? Affordability, accessibility, capability, and acceptability in access to work, to healthcare. Basic needs is benefits and social services, economic security and mobility, housing, food, and nutrition. Healthcare workforce is pipeline and recruitment, education, career progression, and equity and diversity. And then mental and behavioral health is interventions and treatment, capacity and access, education, awareness, and prevention. There is then a general fund focused on a couple of key populations: immigration, justice-involved individuals, low-income individuals and family, older adults, people with disabilities, veterans, and then young children, pregnant women, and new moms and dads being areas that they're interested in as well. In conversations I've had with the program officers, there are two populations in particular that they always talk about. One are underrepresented populations, especially in the city. The other is rural populations. They have a real desire to try to push out more services into to rural areas. And so I would also encourage anyone who works in that area to think potentially about what you might be able to do outside of Buffalo itself. Special note, because I think this is really important with Cabrini. All grants must adhere to and comply with the ethical principles, tenets, and teachings of the Roman Catholic faith, including but not limited to ethical and religious directives for Catholic healthcare services published by the United States Conference of Catholic Bishops. If you are proposing anything that does not comply with the principles of the Roman Catholic Church, this is not the opportunity for you. And talk to us and we can potentially look at other opportunities for you. But I think it's really important we get this right out in front. And those of you who have worked on this in the past, you're well aware of this provision. So a few things to keep in mind. Mother Cabrini in the past receives thousands of LOIs. I think last year, John said they received something like 27,000 LOIs through their open call. So it's a lot. It's very competitive, and I think this is also reflective of why they're talking about limiting the number of applicants to by institution. Although it's always variable, the foundation typically invites about 1/3 of those applicants for a full proposal. As I said, last year we submitted 27 LOIs. 4 were invited for full proposal at half the requested amount, and 3 were actually funded. So again, you might ask for $500,000, you get invited, but they might say, we invite you at 250. This is where I think it's really important, and I want to spend a little time talking. Cabrini is not focused on research. They really look at direct service. The term that the program officer has shared with me is downriver or downstream services. So while we are a research institution and we all want to be involved in that, as you're thinking about Cabrini and you're thinking about crafting a concept, think about what is the impact that you're having in the community that research might inform, but the basis of the concept must be the services that you are providing to the community. Impacted community partners are critically important. We have been applauded for the deep, rich partnerships that we have had with community organizations, and that has been one of the reasons why we've been successful in getting submissions approved every year. I think along with the direct service, it's really important to estimate the number and the population served and to provide a timeline of services. This can be a table, briefly outlined in activities, however, but it's really important to really articulate the anticipated number being served, because there again, it really ties back to what Cabrini is looking to do, which is get services into underrepresented areas and populations. So, identifying that population and the volume that you potentially could serve is critically important. And then just a note, all requests for renewal. So if you are looking at renewal, has to go through this process, including the limited submission competition. So something to keep in mind there as well. Cabrini has great information. I would encourage you to look on their website for information. Or you can, of course, reach out to me. And that is my very quick overview of Cabrini and the process, and I am happy to answer questions that you might have.
Does anybody have any questions for Jeff about the internal process that we're implementing this year? Anything?
Yeah, hi, this is Sonia from Department of Orthopedics.
Yes.
I was a few minutes late, so could you please mention to us deadline to submit a letter of intent or intention?
So yeah, let me go back to.
Thank you for understanding.
So we're doing so we have to do things a little differently because we are anticipating. It's really bizarre. Can I stop sharing my screen? As I'm looking through here, I'm sorry. So we have to do things a little differently because we're anticipating Cabrini limiting the number of submissions that we can send this year. So the LOIs, we anticipate LOIs being due the end of April as they have been previously. However, because we are anticipating a change in policy from Cabrini where we're limited, we currently have a limited submission competition open now with the due date of March 17th. And the concept, it's a one-page concept, requested budget amount, a bio sketch, and the area that you are interested in submitting, the topic area.
Thank you. And we are submitting this, it's supposed to be a link or contacting you?
The limited submission, so if you go to the VPR's website, SPS, there's actually a link on the website. I can send that out to everyone, Karen, if they don't have it, where there's a link that you will submit your concept to through that.
Yeah, that would be
Just-
great. Oh,
I
here
just put it in the chat
I see
too.
the link. Thank you a lot.
Yeah. And once you hit that link, I think you do need to sign into your UBIT, and then there'll be a list of all of the opportunities, and Mother Cabrini will be there, and there'll be like a button that says apply. Jeff, there's a question in the chat, if you would mind showing the slide with the interest areas again.
Well, considering I'm having all sorts of problems with the screen right now, let me try. You can't see that, can you?
No. Oh, there you go.
I guess I'll do it this way. Oh, there's the stop sharing. Multiple screens. So there are essentially 5 areas: access to healthcare, healthcare workforce, basic needs, mental behavioral health, and then the general fund. Other questions?
Hey Jeff, this is Nandor Pinter from Department of Radiology and Neurosurgery. I just wonder who could give us more information about the specific priority areas. If I have a specific idea that I'd like to submit, let's say for the workforce, who can I talk to see if this is a good
Nandor,
idea?
you give me a call. I'm happy to talk through it with you.
Wonderful. Thank you so much. So,
Of course. And sorry for all the confusion on the screens. All of a sudden, things got hidden, but here I am, I think, maybe.
Hi, Jeff and Karen. This is Shelby from School of Public Health and Health Professions. I just wanted to ask you about the adjudication internally of the LOIs before it gets sent to Mother Cabrini. Like, how is that done? You know, what kind of, is there a committee?
So
I
what
just wanted
the
some
concepts
information.
yes, the concepts will be reviewed by an internal committee, working on putting that together now. The LOIs then, when it's submitted to Cabrini, they have obviously their own process. It starts with the program officer reviewing things and making some selections, and then it goes up to the VPs for consideration, and then onto the board. So it's not a committee per se. They've got program officers with specific areas of strength, which I think is important to identify your concept or the LOI with the area, because then you're dealing with a program officer who has familiarity with that area. But it's interesting because in talking with the program officer recently, I had not heard this before. They will then send their recommendations to their respective vice presidents. And typically those recommendations are accepted for full board approval. But occasionally they'll look to say, oh, geographically, we're trying to focus on this area. So, we're really looking for things there, or we've been doing a lot in this area, so we're going to shift some things. So the program officers aren't always aware of those sorts of conversations that are happening at that next level. But anyway, adjudication is really through that program officer. And so I think, thinking in those terms is important. The other thing I would say, and Shelby, thank you for the question, because it reminded me of this. When I spoke to the program officer and we were talking about this, he said, Jeff, we get so inundated with LOIs, the ones that really catch our attention, we go wow to. So think about the wow in your writing up of the LOI. What's really going to capture their attention? It might be a great program and fits all the bills, but if it's similar to what they've seen, or doesn't feel innovative or wow, that's likely not going to get a lot of consideration.
Okay,
Does
thank
that
you.
help?
Yeah, it did. Thank you.
Okay.
I have a question about the the extent that data collection or any research? Like, so you mentioned that they're not interested in research,
Correct.
but if you're developing kind of, I'm thinking of, for example, like some kind of intervention program or rehab type of program where data collection would be useful to understand like the effectiveness and as like a
Mhm.
metric of outcomes. Is that something that is like expected there, or like how does that work with these applications?
I think if data collection in um, that context, Thomas, should be ancillary to the program. The program is all about intervention and the numbers that we're able to serve through the
Mhm.
intervention. And while we're doing it, we're also collecting data to better inform our intervention going forward. That would be okay, but if we start with, we want to establish a pilot to better design an intervention, that's likely not going to go anywhere. So kind of think, turning it that way, that that could be of interest.
Okay, so maybe as a follow-up, does is a project more likely to be successful and funded if it's based on something that's well established? Or, I know you said there's a wow factor there, maybe, but like,
Yeah,
is
not
something that's novel but not as well established with a base of evidence as that?
yeah. I think that they're looking for the novel, the unique, the innovative. So I if there's not a body of knowledge that you're drawing upon, but you've got really kind of a, a unique idea that can really impact a lot of people, I think they would be very interested in seeing that.
Okay, thank you. It's very, very
Yep.
helpful. Thanks.
Budget limits. Great question. So most of the budgets are usually between one and $300,000. It's for a year. Um, we have seen some proposals that have gone in for more than that. We've actually been funded for more than that on occasion, but I think the sweet spot is that $200 to $300 range. Um, so that's the range you should be looking at. And as I said, in many respects, if you are invited to a full proposal, it's rare that we've seen a full proposal at the budget that was initially requested.
Any
Any
other
other questions?
questions? No?
As I said, I'm happy to have conversations with anyone offline. So please feel free to reach out to me. We can talk more about the process, Cabrini in general, your concept, and whether we think it might be a good fit based upon what we know. Happy to do that with anyone at any time. But I think that the real takeaway is keep in mind that we do have that limited submission competition with concepts due on March the 17th, Tuesday.
And that is
And
required before an LOI would be allowed.
that is required before an LOI because we are anticipating this change with Cabrini where they are going to limit us the number of LOIs that we can submit.
There's one other quick question about eligibility. Who's eligible to apply? Is it just UB faculty?
Sonia, can you, I'm assuming Sonia, it's you. Can you just ask or give me a little bit more context?
Yes, because again, Department of Orthopedics, so like we have research faculty, we have clinical faculty, physicians, but we also have residents or chief residents in some projects that we are like working together. So who is eligible for some awards? Kind of like it should be like a young faculty, or do you have any, like how is Mother Cabrini uh, defining eligible PI.
So Mother Cabrini does not define eligible PI. UB defines eligible PI.
Or UB,
Yeah. So what if you would be eligible as a PI for anything else, you would be eligible as a PI for Cabrini.
Thank you.
So I have to look. I don't recall, Karen, do you know about residents if they have PI eligibility?
I don't want to say because I am not sure.
Yeah, usually
think-
they do not
I was
because
going
they
to
are
say,
not a UB faculty.
I was going to say, I
And
think it's no,
yeah.
but I didn't want to say that for sure, but I
Yeah.
don't think they do.
Yeah, that's why for all like other grants, like you should be or clinical faculty slash, for example, in our case, surgeon or like research faculty, etc. So
Yeah,
that's why I wanted to double check.
Yep,
Yeah.
if you qualify as a PI through UB or can get approved as a PI,
Right.
then you would be eligible to
Yeah.
submit.
Thank you.
Marcy?
So, if we have faculty that, like clinical faculty, for instance, that work at ECMC, would we be better off submitting through ECMC since UB is limited or likely limited to what they'll be able to submit?
Well, everyone's going to be limited to what they can submit. It's not just UB. I
Or is there like an advantage of submitting through UB than like a hospital?
I'm not sure if I have a good answer either way, Marcy. I think that we've been very fortunate and very successful in previous years. I think certainly the hospitals are would be likely as well to be successful in many cases. I think it's a matter of preference, who's responsible for conducting the program. If it's a UB program, it probably needs to come through us.
Okay.
So there's a couple things in the chat here. First of all, thank you, Brian. He put a link in there about PI eligibility.
You're welcome.
Be sure to complete the poll that we have put out here. And Amanda has a question about the specifics for the concept paper. Is there any kind of outline or?
There's not. It really is. It's a one-page concept. So talk to us about what you want to do, what the population is, or area served, anticipated outcomes. It's really as simple as that at this stage. And Amanda, if you want to talk more offline, I'm happy to have the conversation with you. So it's the one-page concept, identifying what area that your program would fall under. That would be the workforce, behavioral health, access to healthcare, basic needs, or the general fund. The amount that you are anticipating asking for, and then a bio sketch. But that concept is fairly generic at this stage.
Can everyone please fill out the poll before signing off? Are there any other questions? No?
Well, hopefully that's enough to get you started. And again, I am more than happy to meet and talk with any of you at any time. So please don't hesitate to reach out if you have other questions.